how to do a consult respectfully. So recently, I had a patient come in who had had a consult elsewhere. They were seen by the nurse or the patient coordinator, had a conversation, told them what they needed, and told them to get in a gown. So they then got in a gown, and then the doctor came in, spent about 3 minutes with them, and told them, "Yeah, this is what we do," and walked out. At least that was their perspective of what happened. I don't think a consult should ever go that way. In our office, and the way I do it is I always see my patients dressed. I think it's rude, and it's also very makes a woman in particular feel particularly vulnerable to be basically naked under a paper gown and have a male doctor walk in, or any doctor. I mean, who wants to be naked first time you meet somebody? I just think it's the wrong thing to do. So I always see a patient with them clothed, preferably in my office in a nice setting with the door open. But these days it's in the exam room. But we get to know each other. I learn about them. I learn about their family, their kids, what kind of work they do. I want to have a good feel for who they are and what they do. How far do they travel for work? So I'm starting to get a perspective on how recovery is going to go, so I can answer that correctly, and whether they're going to be traveling a good distance or not, and exactly what they're going to have done. So we have a talk. I find out about you, your past medical history, what you're thinking about doing. I step out, you change, and rarely do I need to have someone take their panties off or their bra off. If we're talking about a tummy tuck, what's the purpose? But I have them get in a gown. We've already created a rapport. We already have some trust, instead of me walking in on someone naked. It's just the wrong thing to do. And I hear that sometimes from other offices, and I just cringe. I just don't like it. Other things that I think about is when I examine someone, if I'm sitting, they're sitting. If they're standing, I'm either sitting or standing. But I rarely examine people sitting. Several years ago, I walked on a patient during the exam portion, and they were just pulling up their jeans because they were a mom. They've had 3 babies, and they have a little pooch. That's why they're here, is to get rid of that pooch from their abdomen, and they're fighting to make it not so apparent, because it gets worse when you sit down. And when I saw that patient, I decided I will never examine a patient sitting again. I wouldn't like to be examined sitting. So I always examine my patients standing. And I actually tell them why I'm having them stand instead of sitting, and my experience with that. Again, I think it's much more respectful. It's not calling attention to it, and it's an easier and better way to be. And finally, the other thing that I think I harp on is I don't like to examine someone or talk to someone or meet with someone with me up here standing and them sitting down here. I think it's a very vulnerable, a very looking downward relationship, and it should be an equal relationship. They're evaluating me as they're going to be their doctor or not, and I'm doing the same to them. Are they rational? Are they sane? Are they have reasonable expectations? We need to approach that on a level, even playing field. And so I think it's very important to assess people sitting. And they should be sitting, and we should be talking to one another and filling each other out and seeing, can we establish a bond? Can we move forward with what we're trying to do for them? So just some ideas on how to examine someone and how not to examine or do a consult with somebody.